Thank you for tuning in to another episode of Watson Clinic Health Talk. Our guest today is Dr. Taylor Cook, a board-certified OB-GYN who accepts appointments from one of our new locations, Watson Clinic Parkway Medical Center, a 4-story, 80,000 square foot facility housing many of our most popular specialties. You'll hear more about Parkway Medical Center and the 2 additional facilities that share a campus with it, including Watson Clinic Surgery Center South and Orlando Health Watson Clinic Lakeland Highlands Hospital, later on in the show. Our main topic on this episode is pregnancy and what expectant parents should anticipate during each stage of their pregnancy, from important screenings to developmental milestones to perhaps most overlooked, the challenges you can face after giving birth. For more information and to schedule an appointment with Dr. Cook, call 863-680-7243 or visit watsonclinic.com/cook. Thank you for coming in to talk to us today, Dr. Cook. I appreciate it.
Thank you for having me. Thank you for the invite.
What made you decide to be an OB-GYN? What was that initial spark?
So it all happened third year of medical school, and just so y'all know, in third year of medical school is kind of when you do your core rotations. And so you get out of the classroom and you start to get out into seeing patients and seeing kind of the breadth of medicine. And when I went into medical school, I was dead set on cardiology. I'd done research in cardiology. I thought that was fascinating. And I hadn't really given much thought to OB-GYN at that point. And during my clerkship rotations for my third year, I was able to work with a private practitioner in Jackson, Mississippi. And he was a workhorse. He would go and do hysterectomies and go see patients in the office and go to deliveries. Like, he gave me the glimpse that I needed for private practice OB-GYN, and just seeing how vastly different each day could be, seeing how fun deliveries could be, seeing how enjoyable surgery was. I felt like OB-GYN just as a specialty in and of itself gave me everything that I was looking for. And then it just, taking care of a patient during pregnancy and then transitioning to managing their bleeding or doing a potential hysterectomy or menopause or all the things that happen to women over a course of adolescence to old age was just so intriguing and fun, and you just got to be a part of it at every era. So I thought that was just, to me, more rewarding.
And in terms of pregnancy and delivery, I mean, it's the most special period in a person's life.
It truly is.
You get to be witness to it.
It is. When you take a step back and think about how transformative the day of birth for their children is for that couple or that person themselves, is just wild. And I've had a couple kids, and so I'll relate to it from a personal aspect. But my goodness, it is all the emotions all wrapped into one in just a short period of time. And so getting to be their physician during the pregnancy and having them trust in me with not only their well-being, but their soon-to-be babies' well-being is just incredible. And then, fortunately, most pregnancies are straightforward, uncomplicated, just kind of we're watching the kiddos as they grow and develop. But then there's sometimes that we do have to observe more closely or manage other medical complications during pregnancy. And so kind of doing all of that and then having that amazing result at the end of it as well is highly rewarding for everyone involved. Yeah.
So you, having given birth and been through that process yourself, did that experience kind of inform the kind of OB you'd like to be?
It definitely did. I am more sympathetic to a lot of things that moms-to-be and new mothers go through. I found especially a new appreciation to recovery from the delivery as well as just postpartum care to be a lot more involved than I had initially given it credit to. Because I knew, being pregnant's not always the most comfortable or always the easiest. And delivery is, I mean, in and of itself, no easy way to get a kiddo out. So I think what really shed a lot of light was just kind of postpartum healing and the challenges there. And then, breastfeeding or formula feeding or however you choose to feed your child. I felt like all of that, gets kind of glossed over in a lot of education and a lot of obstetrical practices previously. And so now seeing it firsthand, I try my hardest not to gloss over any of that aspect.
Pregnancy is such a spectacular, exciting, joyful period of time. But I would imagine, especially first-time expectant parents, they might have some concerns and questions about what can I expect from this experience. So I'm curious, what are the most common trepidations first-time expectant parents come to you with?
At least a lot of my patients are more kind of the type A personality, and everyone feels more comfortable when they have a semblance of control. And so one of the first things we talk about, especially when we get in that third trimester of pregnancy, is that this is a uncontrollable situation. We kind of have to roll with the punches when it comes to how babies come out, when they come out, and everything involved with the labor and delivery process. And so kind of having that conversation to set expectations is one of the bigger ones. A lot of patients, of course, then want to see and tour the facilities. And so I know we are working on a way to finalize hospital tours with the new Orlando Health Hospital, which, by the way, it's gorgeous. But it is something that I know patients just want to see that place prior to having a kiddo. I think also one of the big things is, how are they going to have the baby or what does that process look like? And it's different for every single patient. And unfortunately, I'd love to promise you an uncomplicated vaginal delivery from the get-go, but that is beyond my control. So I again, opening that conversation about how, as long as we have a healthy mom and a healthy baby, that is our primary goal. But obviously, we know that health of a mom is not just the physical health, it's the mental health. And so trying to at least communicate during labor and delivery what we're doing, why we're doing it, the benefit, the risk, all of that information to allow patients some, obviously some say in their care if everything is going well. And obviously if everything is not and we have to intervene medically, patients typically have that trust in us because we did come to this place with an understanding of how all this is new and foreign. And so I feel like with all the education that we try to do, in the office or during labor, especially that relationship I have with my patients in labor, and then knowing that if things were to change, they already have a baseline foundation with me. And so they have that trust when I say, hey, we need to, go to plan B and unfortunately, do a C-section or whatever that other plan B looks like. They usually are a little bit more calm and collected during that moment because we've already had that pre-conversation.
A patient finds out that they're pregnant, and they don't have an established OB. Do you recommend ASAP to establish one and start on that journey of prenatal care?
Yeah. So one, start taking your prenatal vitamins. Make sure it has DHA, folic acid, and iron. And then two, call over and schedule a new OB appointment. Typically, we like to see patients kind of roughly around 8 weeks gestation. Then when we do that ultrasound that first time, we should be able to, hopefully, see around then aged baby. So definitely call over then because I know we can unfortunately book out, but then we would see you about a month later. Now, of course, if you've had previous complications during pregnancy or you have any specific concern, just then definitely reach out to the office with those concerns, and we would probably see you sooner than that, depending on what's going on.
Can you tell me about some other screenings and tests and that sort of thing to make sure that as the baby develops that it's developing healthily?
Sure, yes. So at that first visit, it's super important because we go through, and I'm going to talk about mom for a second. We talk about, getting the mom an up-to-date pap smear. We also screen for majority of sexually transmitted diseases to make sure, again, things that are present can sometimes affect baby as they are developing. So we screen for all of those to treat or rule them out from the get-go. We also check mom's blood counts and blood type because that can also affect future pregnancies. And there might be some indications of adjusting things during the pregnancy there. And then we offer a couple of different screening options to rule out genetic concerns with the fetus. We do something called a non-invasive, or it's elective, a non-invasive prenatal test. It's a blood test on moms to see the fetal DNA that is in the maternal bloodstream to determine gender, which is always fun, but also to look more into concerns of trisomies, where there's an extra chromosome at certain spots of the genetic mapping, like such as Down syndrome, trisomy 18, trisomy 13. Those are the more common ones. And we also look at some sex-associated disorders there. We also can offer something for the moms, particularly called a carrier test, to see if the moms carry a gene associated with some rare disorders like cystic fibrosis or spinal muscular atrophy or Fragile X, and then we can see how that would affect baby based off paternal carrier testing. And then we offer something called maternal serum AFP and alpha fetal protein to see if that is elevated and can be elevated in certain disorders. We do typically then routinely an ultrasound around 18 to 22 weeks, looking for the fetal anatomy, making sure that the baby is developing appropriately. And if there's any concerns there, then kind of working up the chain and potentially looking for causes and, of course, treatment options down the road. And then typically in the third trimester, we always recheck to see if the mom is developing any anemia, making sure baby's developing appropriately there, as well as doing something called a Group B strep swab rectovaginally and seeing if the mom is carrier for that, because that can affect how we manage labor, or if we give antibiotics during labor to help protect kiddo from getting exposed to that. So that's kind of like a rough outline of a lot of the things that we do. A lot of it is, of course, maternal centered because we want to make sure that mom is doing well and is otherwise healthy. I also forgot to mention that in that first visit during prenatal labs, we also check titers, or we check to see if mom's immune to rubella or other childhood vaccines. Because again, if she were to contract some of these things during pregnancy, that can directly affect the baby depending on when and how bad. And so we do screen for a lot of that so we can give expectant management during pregnancy.
Does a pregnancy, is there the risk of it exacerbating pre-existing conditions like hypertension, diabetes, that sort of thing?
Unfortunately, yes. I know pregnancy is incredibly common. That is why we are all here. But it is not an easy time in a woman's life. And so unfortunately, if a patient comes in with a pre-existing condition, hopefully it's been well managed and they're in a good starting point. But if not, during the pregnancy, we will continue to monitor that pre-existing condition, make adjustments to medication. Lots of medications are safe in pregnancy and some aren't. So that's when we are having these prenatal visits, we're always doing that risk-benefit ratio. And making sure that we keep a close eye and potentially co-managing with specialty doctors these medical conditions during pregnancy. And sometimes that can change when a baby is delivered, depending on how it's affecting mom, as well as how the baby is delivered, depending on how it's affecting mom.
So you guys will work with other specialists throughout the clinic on the kind of comprehensive care for the patient.
Absolutely. It does not just stop at us. I wish I knew everything about everything that could happen to women and their childbearing ages, but that is I know enough, and I absolutely safely manage patients during that time, but also I know that there's a certain point where it needs to be co-managed by cardiology or pulmonology or other specialties to make sure that mom is topped off.
Yeah, and that's the power and the benefit of being part of a multi-specialty clinic like
So much
Watson
easier.
Clinic. Yeah. You mentioned medications a little bit ago that most are safe, but some are not. Which medications are generally off limits?
There's certain type of blood pressure medicines, ACE inhibitors and ARBs, like lisinopril is the first one that came to mind that I would switch off or switch over during pregnancy. There are some seizure medications that we discontinue during pregnancy. There are some antibiotics that we avoid during pregnancy. And then, of course, a lot of chemotherapy regimens. We would not continue during pregnancy. So that's kind of like a general idea.
Foods to avoid.
Try to limit caffeine up to 200 milligrams per day. Avoid alcohol during pregnancy. Unfortunately, there's no safe amount of alcohol that we have seen. So therefore, we recommend just avoiding alcohol in general. Avoid any fish with high mercury count. It's usually fish that eat fish type of thing. Avoid raw meat and avoid any listeria outbreaks. It's been public knowledge whenever there's a massive listeria outbreak, but unfortunately it's not just on cold cuts. It can also be on unwashed fruits and vegetables. So again, wash your fruits and veggies. And typically with, your cold cuts or your meats, just make sure they're heated up. Typically would do like a hot sub or hot cold cuts instead of just fresh out of the fridge.
Should you start or modify your exercise regimen once you find out that you're pregnant?
Yes. So it is incredibly important to keep moving and being active during pregnancy. I know it is also very difficult to do that, but it just makes the aches and pains during pregnancy that much easier. It makes the labor process potentially a little bit easier on you. And of course, the recovery if you're in a good physical status. Typically, most women come into pregnancies with some sort of physical activity, and I encourage them to continue it, whether that's low impact, swimming, jogging, elliptical cycling, etc. That is all safe and fine in pregnancy. If you are a bodybuilder and get pregnant, I typically recommend 60% of your max weight is going to be what you can now safely lift during the pregnancy. But of course, during any exercise or physical activity, if you start to have any spotting or bleeding, or if you start to have any cramping that is persistent, then lay off that activity. Also, make sure you are hydrating. It is Florida. It is hot. If you're doing anything outdoors, one, do it at, non-peak temp hours, but two, make sure you are drinking over 100 ounces of water a day. Electrolyte-rich fluids incorporated in that as well. If you are coming into the pregnancy and you are not physically active, that does not, unfortunately, give you a pass to continue to not be physically active. Well, no, I would not sign yourself up in your first trimester for Orange Theory or some sort of crazy workout class. What I would do, though, is I would encourage you to get out and start walking, get out and swim, especially again in Florida in the summer. Get out and just move your body purposely, doing things that you love, picking up a dance class or just something. Because again, movement is so important to make this process easier. But I don't want you to just jump in 100% and push yourself to do some sort of physical activity you were not doing before.
Okay. You mentioned something about spotting and cramping during exercise.
Yes.
And there, I would imagine there are a host of things that an expectant mother can experience where she might think, oh gosh, I need to schedule an emergency visit, and not knowing that it might be just a common part of the process. What are those symptoms that warrant an emergency visit, and what are some of the ones that are just a normal state of pregnancy?
Yeah, so there's obviously kind of some of these symptoms may change based off the trimester, the time of pregnancy. Of course, in the first trimester, please reach out at least to the office or potentially to the on-call physician if you are experiencing significant heavy vaginal bleeding or cramping to the point where you feel like it could resemble a contraction. Depending on kind of the unfortunate level of bleeding or the level of pain, or if you have any like lightheadedness or dizziness with those symptoms, we may instruct you to follow up with the office versus go to the emergency room. But those are definitely things that we are watching out for. And the second and third trimester, persistent headaches that are unrelieved with Tylenol, or nausea, vomiting, diarrhea lasting greater than 24 hours, feeling faint or dizzy, or having a syncopal or passing out episode, or any trauma to your abdomen, even if you're not contracting or bleeding afterwards, but just any trauma to the abdomen is worth a phone call and possible emergency visit. Then there's the signs of labor, so regular painful contractions. Even if you're preterm, we need to know about these things. Regular painful contractions, vaginal bleeding then, big gush of fluid, indicating that your potential water bag may have broken, or decreased movement, especially in the third trimester, when you would start to feel more regular, frequent movements. Things to watch out for on like a blood pressure standpoint, of course. I know that is a concern, is, that persistent headache, sharp stabbing pain in the right upper quadrant, swelling predominantly in your face and your hands that is new or worsening, shortness of breath that is a rapid onset, or chest pain, as well as elevated blood pressures at home. Now, I understand a lot of our patients have access to blood pressure cuffs at home. So we're looking at, 140s over 90s. But we will bring you in to verify it in the office or the hospital, depending on, day and time, because we also know that cuffs may vary. So we don't, we absolutely trust, but we verify based off calibrated blood pressure cuffs. So this is a general list of things to kind of watch out for. But again, when you go through a pregnancy, you expect to have some, back pain and some occasional contractions and some of these normal things. But if it kind of rapidly changes, or it's a new or concerning finding to you, if it raises a red flag in your brain, please reach out. The worst thing we're going to say is, hey, that's normal, but keep monitoring and let us know if it changes.
Yeah.
And the best outcome, again, is to, hopefully nothing's wrong, but we would bring you in to verify and validate and make sure everything looks good. You definitely want more reassurance in pregnancy, because unfortunately stuff happens. And so we want to check in on that.
Is there usually a question as to whether or not a person's in labor? If they're unsure, should they call and describe what's happening?
Yes, because everyone's pain level is different. And I've seen it where patients are barely grimacing and about to have a baby. And I've seen it personally where I thought I was having the most painful contractions and come to find out probably could have been worse. So the only way we can verify if somebody is truly in labor is twofold. One, having them be on electronic external fetal monitoring, in which we can monitor, fetal heart rate, as well as tachometry, which is a measurement of the frequency of contractions, to see how frequent the contractions are, as well as, doing a cervical exam where we see if the patient is having any cervical change or any dilation there. So unfortunately, I can't determine that virtually or over the phone, or a lot of times if patients are unsure, if they're reaching out to me and their contractions or their abdominal pain, back pain is kind of, coming and going and ramping up, maybe becoming more frequent or more painful, I encourage them to get evaluated just so we can let them know. And again, worst case scenario, they go home. They don't have a baby. It's not time yet.
And like you said before, there's also the post-pregnancy, the post-birth period, where you've just undergone such a dramatic, profound, life-changing experience, and now what? And so you might offer guidance to new parents during that stage as well.
Yes, it is it is one of those transitions that, again, I was woefully underprepared for. Just because when I had my first child, I was an OB-GYN resident, and I had seen hundreds of births already. I had seen many a postpartum patient in the office, and no one ever lets on, I think, how difficult it is until you personally go through it. And going through that transition, and while I had my husband, but we were kind of otherwise limited with family support because we lived in a different state. It was a lot. Babies are not easy, and you hear thousands of times they do not come with an instruction manual, and they don't, nor do they come with guaranteed sleep or any of that. And so I thought I was safe from all that, in the sense that when you're a resident, you're used to doing like 24 or 26-hour calls. You're used to being up and working all night. And like as an OB-GYN, same thing. Deliveries don't stop when the night starts. It's all the time. So I thought, sure, I could handle middle of the night wake ups. And then someone very eloquently told me, again, they don't have guaranteed sleep. So it's not like you can work a call and then go home and sleep for 12 hours straight. You are up when they need you, and then you sleep those little glimpses that they sleep. And it really messes with people, especially that love sleep and need sleep. And having a good support system will go far. And I encourage my patient. Well, first I tell them newborn life is difficult, and I'm the first one to acknowledge the trials and tribulations that they are going through, especially trying to navigate nursing for the first time or breastfeeding in general. But also just having a good support system, getting out and seeing friends, getting out and getting that fancy cup of coffee that brings you joy, doing things, and again, with your baby, if you would like to, or take a break, that's okay too. But getting back into those things that bring you happiness pre-pregnancy or pre-delivery will do so well. And then getting outside, walking around. It is so easy to stay in a dark room in your house with a baby because maybe they'll sleep, maybe you'll get sleep, and I get that. But also getting outside and seeing the sun and getting fresh air will lift your mood. Fellowship and, nature, going back to the things we've been doing for centuries really does help in that new transition period.
You and some of your OB-GYN colleagues have started accepting appointments at our Parkway Medical Center, which is a brand new medical office building we just opened. And it shares a campus with the Watson Clinic Surgery Center South facility and the Orlando Health Watson Clinic Lakeland Highlands Hospital. They're all within steps of each other on the same campus. So tell me, from your perspective, what is the benefit of this campus for your patients?
Well, it's a one-stop shop. So it has been lovely kind of working in a brand new space with brand new technology and making it a little bit easier to take great care of our patients. Being in this office location, steps away from the hospital, steps away from the surgery center, just allows patients to come see us for their prenatal visits. And then if there's any concern or if there's any possibility of them then transitioning over to a hospital setting, it is much easier for the patients than having to drive across town to our previous hospital. So it has been just a convenience that we had not previously had and is welcomed.
Do you anticipate that you'll also be performing same-day procedures at Surgery Center South?
Yes. We'll be doing procedures there. We'll be operating at Orlando Health. We'll be doing, deliveries at Orlando Health. So again, it just makes it more, speaking personally, it allows me to kind of fill my day with the beauties of OB-GYN and what it has to offer, and I can go do surgeries and come back and see patients, or I can go deliver a baby or two and then come back and see patients. So again, it's just a lot easier than
it's great
flexibility. Getting into a car. Yes.
Yeah. Thank you for being the guest on our podcast today. You've been awesome.
Thank you for the invite again. It's been fun.
For more information and to schedule an appointment with Dr. Cook, please call 863-680-7243 or visit watsonclinic.com/cook. And while you're on our website, be sure to take a look at our location links, where you'll find additional details on our brand new campus featuring Watson Clinic Parkway Medical Center, Watson Clinic Surgery Center South, and Orlando Health Watson Clinic Lakeland Highlands Hospital. Till next time, thank you for listening.